Hi, this is where we're at right now. I am on my upkeep dosage of naproxen 500 milligrams and tramadol 50 milligram capsules. Two of these, one of these, rotating through every 5-6 hours because the pain is just kind of always there, but I now have about a week until my operation, so I'm just trying to keep on top of things while I can leading up to that. This is just a wee update to let you know that I had my MRI and I have just received an email from Dr. Mitroy, who's the surgeon who will be doing my operation at the Bucharest Endometriosis Center in Romania on the 11th of July. And I was told that my right ovary has a cyst of about 2.5 inches, rectocervical focus and lus, more importantly on the right, with adhesion of the distal sigmoid serosa. So what I can interpret from that is that, as usual, my right ovary is a bit problematic. Even though I get really bad pain on my left, my right ovary just always seems to have some dramas with it around cysts. There's just always cyst activity going on there. Something I've not had previously in surgery, which it looks like is going to be the case this time, is some bowel involvement, some adhesions. Again, not entirely surprising. That I've also had surgery with my bladder before, so there's probably going to be some involvement there. Luckily, there's no signs of adenomyosis, because the only way to treat that is through hysterectomy. And so that's a big relief because I am wanting to go through fertility treatments after this. This was a big push actually to have this surgery. So knowing that I can hopefully keep my uterus and ideally my ovaries, that would be, that's definitely a positive. So I have been told when I had my last surgery 3 years ago now, that the next go around, my right ovary may need to go, depending on how things go with the removal of the cyst, and what else they find regarding that ovary when they go in. They may need to remove that ovary, but we'll see how it goes. I'm just trying to mentally be prepared for anything. You can still attempt childbirth with one ovary, so I'm trying to not get too in my head about it. The email that I got was really, really kind, saying we're prepared for anything, so you don't have to worry. I have inquired further about the pudendal nerve aspect of the surgery, so that's where I've been getting kind of numbness and tingling down through my legs, and that's all because the endometriosis has impacted my sciatic nerve and around that area. So depending on how severe that is will depend on if we're going to operate there or not. So I'm open to it. As I send in kind of my response email, I'm open to it, but I know the recovery time for that is quite intense and that there's a lot of room for error in that kind of surgery. Not trying to question the expertise of them, but I just know any kind of nerve stuff is a bit risky. So I'm just going to be led by their expert insight. When I get there, I'll have a bit of a they'll have a bit of a feel around to see, I guess, how bad the nerve damage is, and then we'll go from there. But that's the update that I have in terms of what is looking like will happen during this operation. I know I'm in really good hands, so I'm nervous, but I'm kind of looking forward to just hopefully having a bit of my health back, because it has been deteriorating rapidly over the past few months. As some of you might know, I was in hospital week before last, and I'm pretty sure I had a cyst rupture, but I had this whole battle in accident and emergency about not getting sent on to gynecology despite me being currently under their care. Basically, it's all just a bit of a mess right now. So I think I'm definitely making the right decision to pursue surgery in Romania, to try to get a handle back on what is going on in my pelvic region and beyond. But yeah, so I'll let you know how prep goes with everything. Thank you so much for all of the support, kind messages. Everybody was really, really lovely when I was in hospital. I don't want a repeat of it up until surgery, so I'm trying to take it a bit easy. I'm still doing workouts, trying to eat decently and things, leading up to the surgery to keep myself as strong as possible. But yeah, that's my update for now. And again, if you have the ability to donate at all, that would really mean a lot. The quote that I've now been given for surgery is anywhere between 3,000 to 9,000 euros. So it's a big variety of things. You know, having the insight from the MRI helps a little bit. It helps plan things out a bit, but we still don't know until they go in exactly what the endometriosis is doing. But yeah, so again, thank you so much. And I'll keep in touch.